It's HIPAA compliant, and we have levels of permission set for each section with regards to viewing, interacting, and editing. So it could be that the administrator of a memory care center wouldn't necessarily want a family member to be able to view the notes that are going back and forth between the providers, but they do want them to be able to view the other sections, and they want them to be able to edit the psychosocial section as an individual undergoes changes, and so we can keep the profile dynamic. The CME platform is web-based, so it is not an app. It is shared via URL, so there's no need for the end users to subscribe or to download an app. It can be opened and easily translated, by the way, to ensure health equity amongst diverse populations on any smart device. So, moreover, the interactions and access of the profile, we collect into a log that can help an organization improve their operations, their staffing. It creates a digital breadcrumb trail that facilitates an understanding of the patient journey. And this is all done so that we understand who a person is, what their journey through the healthcare system is like, and how to improve our operations and provide coordinated care for this person. So here is how it works. An organization, say a payer or a healthcare system or a clinic, makes a purchase of CNME. So they then get a dashboard that populates with all of the data points that CNME collects, and they're able to upload their patient files. So they then can push from their dashboard an invitation to an informal caregiver or a patient themselves when feasible to create a profile, at least the parts that they want those individuals to create, depending on what type of patients we're talking about, but at least the psychosocial section. Those accounts then are managed through their administrative dashboards. They're hosted on a HIPAA compliant remote server. It's accessible over the internet. They are shared securely. Anybody who is an end user has to enter their email, which helps us with our digital breadcrumbs, and they create a secure password. They check a little box that says that they're following HIPAA protocol and all that. And then they're able to see the profile, they're able to interact with it, and the family members, to ensure their peace of mind and decrease their stress, gets notifications and logs pertinent to their level of permission that's been granted, but they know that the information they've shared is being attended to by the folks who care for their loved one. So it is B2B, it is subscription-based SaaS. So if you'd like to help me vanquish the elephant and focus on humans and delivering and receiving person-centered coordinated care outside of traditional EHRs, patient portals, difficult apps, here's how you can do so. This platform, while it's in its current version, which is just psychosocial, is ready now. We're building upon that, this HIPAA compliant platform, and it should be completed by around August. So I am ready to begin conversations with investors, so your introductions would be appreciated. Of greatest interest, it seems, in the market right now for CNME, it's coming from insurers like United Healthcare, which has backed CNME to develop the platform for kids in foster care, Alliance Behavioral Health as well for kids who are in residential facilities and then transferring to foster care. And if you are familiar with other leaders in this space, again, I'd appreciate your introductions. And finally, in September, I'm going to resubmit a well-received phase 1 SBIR, looking at memory care centers. We're working with VAs, and there's another memory care center I'm working with in New Hampshire. But I'd like to garner the support of one more memory care community. So if you have any connections there, I would appreciate that as well. And overall, here is my contact information. If you'd like to reach out, I would love to hear from you. And I'm happy to entertain any questions you might have.
Yeah, I don't have a question, John, but I just wanted to applaud you on A Mother's Passion. having gone through some similar type of challenges and navigating the system. It's impressive that you've coalesced this information, and I wish you the best of luck, and I'm happy to be a resource, however.
Thank you, Scott. I appreciate that.
Thanks, Risa, for your presentation. It's really great to see. I had kind of two questions, and they're really separate. One is, are you still using what from early in your development you were using like QR codes and those kinds of things? Is that still part of the solution? And then could you say a little bit more about your work with United Healthcare?
Sure. So originally, when I developed the platform, we were using NFC cards. So they're like, little credit cards, and you would tap it to your phone. And because it was all psychosocial, didn't have to be HIPAA compliant, the profile would just open, or you could scan a QR code. What we found in further customer discovery is people, particularly when I start looking at memory care centers and the elderly group, they don't get the NFC cards. And moms were concerned that they would get lost, they would get sent through the washing machine. So we moved away from that to a fully web-based platform where you can send the URLs and you can still scan the QR code. So each profile is associated with a QR code that you can put on a sticker outside a hospital room or a memory care center residence room and so forth. So we're still using that, but we've moved away from the cards, if that's what you're referring to. With regards to United Healthcare, I connected with them early on based upon the initial psychosocial platform. They saw the value in it for their Medicaid patients, members, primarily with foster care, since those kids carry around information that is essentially what we have on the CNME platform, but they carry it around in a paper binder, which is neither secure nor dynamic nor easily shared. And in addition, they don't have any record of their life, essentially. So the life book that I mentioned earlier, we're working with foster care kids and we're working with memory care folks. So both of those need a life book to be fully understood and to really address their needs. So for kids in foster care, we want to make sure that they have photos of themselves. Unfortunately, a lot of folks age out of foster care and they don't have any photos of their childhood or any tangible memories. They don't have any connections and phone numbers. On the other spectrum, of course, with aged care, you want to make sure that we understand an individual's life, and you can share memories, videos, photographs, narratives about their life to help bond with them despite their level of dementia.
Thank you.
Hey, Risa, just a quick question. Curious, and sorry if I missed this part, but are you targeting from a go-to-market perspective primarily more B2B, or are you going B2C as well? And does the price point scale?
It is B2B. So we started out with the psychosocial platform looking at B2C. Because the system is so broken, the parents that I was working with had very little confidence that an organization would actually attend to the profile. The organizations I worked with said, this is just fabulous, but we'll never get anybody to complete it. And I realized, although my strong preference is to grow things organically, that unless it came from the top down, it wasn't going to take hold.
Got it. Okay. Thank you.
Sure.
Hey, Risa, first off, really great to see the progress here. And I think you're tapping into a buyer with foster children and these other transitions in the marketplace that, one, is desperately needed, and two, has a consolidated, interested party in that buyer, being either Medicaid plans or state foster care, plans for healthcare. So I think that is fantastic, because I think the original thought you had of trying to approach the children's hospitals and that network was, I think it was a tough sell, even though it's a great idea. One, I love to see the tech transition that you've made. I think it's more approachable and scalable for folks, particularly as you look at memory care. And I also think that is a really smart move, because it opens up an entirely different market. And, Look, we all have family issues, and there's lots of complexity in our lives. And because we're sandwiched between both of these situations in many families, I think it's opening up a whole other market. So I compliment you for thinking outside the traditional mother-child box, which was inspirational for you, to something that's also quite practical for many of us. So well done.
Thank you. And this is personal to me as well. So while I have a son who has Tourette's, I have a daughter who's adopted from China who we knew nothing about. And I had a grandfather who died of Alzheimer's. So I'm kind of, and my mom is 83. So we're
Okay.
getting there with regards to adopting every one of those perspectives and trying to build for what I need to. So I appreciate that, Dick.
Good. Well done.
John, this is Elizabeth. Can I have a quick moment? I can't raise my hand online.
Hi, Elizabeth.
Hi, Risa. It's so wonderful to see you. Again, it's been a while. I'm just going to echo, thanks for stealing my thunder over there. I'm just going to echo what Dick just said. You've come a long way, baby, from the very first time we met. I think your current presentation, and I don't know how often you're using this, is absolutely brilliant. It focuses on the genesis of the real problems that we see across the board, regardless whether it's memory care or divergent. And that makes it very personal for us. And we've talked in the past about when you're talking to an audience, especially when you're talking to, we're talking to anybody, but investors in particular, is how do you make it personal? How do you get them to own this? And I think you've done a really good job with this. You've come away from something, you've just evolved. And I want to just give you lots and lots of kudos and for your perseverance, your new presentation, which I think is brilliant. And I look forward to seeing you again soon in person.
Thank you.
So take care.
In all transparency, Elizabeth is a member of my advisory board. So she doesn't have to say nice things about me, but I sure appreciate it.
I'll weigh in and second that too, because obviously I know what I've to do over the last couple of years too. I can't second that enough. I mean, your presentation has gotten significantly better, but beyond that, I mean, I think the progression of the company overall has been really, really good to see. So just want to congratulate you on that. I think, as I said, both the company and as I said, this was an outstanding presentation. So
Appreciate that. Thank you.
This is Mariah with Community Health Council of Wyandotte County, and I have a couple staff members who are on a statewide advocacy group for families with children with intellectual disabilities and atypical neurological children. Is there a best way for them to contact you or to get them access to the slides? I screenshotted your contact slide at the end. Is that the best way for them to reach out to you?
Probably so. Yes.
Okay. All right. I'll make sure they have that information. Thank you so much.
Look forward to hearing from them. Thank you, Mariah.
Risa, you had indicated that you're looking for another memory care site. Are you needing that? Are you wanting that specifically for the SBIR, or is that separate?
Well, any population I can get to assist in the beta test and the data collection for that, it would be welcome. But the SBIR I proposed does require 2 sites. So I have the one in New Hampshire and I am looking for another. Just turned in another grant last week to the DoD to work with the veterans population in Eastern Kansas and Wichita. So that could suffice with regards to their community living centers, but I would like to keep that group separate for right now and work with the private memory care residences if I can find another.
Okay. Good.
Yeah.
Other questions from the group? Well, I guess I would just ask, is your focus now the grants, or is there kind of a next thing that's in terms of either development or client connection?
Excuse me. The grants are a way, but so I should preface this with, I do have an academic and research background. This is a digital health offering, and I feel it's incumbent to have some outcome data to support it. That's what the grants are for. Once the platform is available and I get some preliminary data, I'll be able to initiate sales. So the research company NDRI will be running most of the grants. So I will be in the background on some of those. I'll take more of a role on the SBIR if we get that. But my role will be developing the relationships on the foster care side and on the memory care side. Once I get some investments where I can scale, then we can start looking at a greater dissemination amongst those two groups before we move into the IDD population and inclusive work sites. I'm in conversations with Amber over at the Golden Scoop, and we're really anxious to start applying C&Me in that type of setting as well. So some of this is just restrained by my limited capacity right now, but the grant is not going to limit my ability to remain mobile in terms of sharing C&Me with the greater communities.
Okay, that's great.
Yeah,
Any-
and Risa, I can't help myself, right? I'm sales and market focused, and my mind always processes that way. But just when it comes to like your go-to-market around foster, I have tons of ideas. I'd love to like just chat with you.
Oh, wonderful. Yes, I would certainly love that. I've got the group in North Carolina with Alliance, and United is helping me on the Kansas side. But aside from that, I think I've spoken to, I don't know, hundreds of hours worth of folks in all the stakeholders in foster care across the country. And it's such a broken system, and broken in so many different ways across the board, that I'd welcome an opportunity to speak with you and hear your ideas.
Yeah, I think it'd be more of like a grassroots, even though you're not going B2C. I think you have a really impactful play if you went and influenced a little bit more B2C, but not one-to-one. So anyways, let's chat. I just have some thoughts. I'll just share them with you and take them as you will.
Wonderful. Thank you.
Yeah, you bet. I'll send you an email.
Thank you. Perfect.
Well, this has been great. Any other thoughts?
I had a
Yeah.
quick question in terms of, as you're going more towards the business side, what if there is a change from that business? How are people sharing that information? If you've got a good collection of information, how does that get shared? Should the original entity that's saving it is changing?
I'm sorry, help me understand. So if a memory care center purchases C&Me and completes digital profiles for all of their residents, are you saying if somebody buys them or they get a new CEO?
Right. If somebody buys them, or a particular individual moves to a new location, or as you were talking about being part of United, there's something within a different insurance. And so now that source of all that information has now changed for the individual. How are they able to still capture all that information that they've been collecting on their profile?
Right. So a couple of things. First of all, my aim is to make it ubiquitous so that a QR code is on every insurance card and every provider in the country has C&Me. That would be the first solution. Barring that, the profiles are not necessarily portable, but we will give a grace period. So if an individual moves from say an assisted living facility, if we're working with all of those, into a memory care facility at a different community, it would be incumbent upon that community to make a purchase from C&Me to maintain that individual's profile. However, there would be a grace period to help integrate that person into it. So while a nursing home or assisted living facility A would still have the C&Me account, we would for free give it a grace period of 3 to 6 months, what have you, as they're moving into a new home, so that, first of all, it's marketing, so that that new assisted living facility understands the benefit of C&Me. But then if they don't purchase it, that individual's profile would go into a suspended account, at least for another year or so. With foster care, one of the things we're looking at is how to maintain a child's profile, because we know that they go in and out and in and out of the system. So we will have a unique ID for that individual, regardless of what system they're in. If all of the United covered kids who go from, say, Ember Hope to St. Francis, that profile will follow them. If they exit and come back into the system in the same agency, still oftentimes there's no record of their previous family. We want to make sure that that continuity is there. So when you type in John Smith, birth date 8/21, 2010, that child's profile will come up in its last updated form. So we are working to maintain some continuity as best we can, whether it's within systems or between systems. Does that get what you were asking? Okay.
Yes, thank you.
Thank you.
Yeah, this is Doug Hohulan. I really enjoyed your presentation. Great job. Yesterday, actually, Children's Mercy hosted a Mid-America Regional Council event for healthcare and AI. And one of the speakers there was on community health project management and kind of talked about similar issues of, and talked about the need of community health workers kind of bridging the gap, which I think, your system helps automate that. And I guess maybe you talked about it. I didn't quite catch it, but could you expand on the community health organizations and how your tool could be help with community health workers?
Sure. So one example, when Mayor Lucas came up with the ID cards for the homeless population in Kansas City, one of the things I would have loved to have seen is a CME QR code on those cards. So each of those individuals likely is seen by a social worker or somebody even in the courts. CASA is involved in foster care. There's got to be some way to ensure that those individuals retain some semblance of individuality and the value of that, as well as continuity in their care. Beyond that, just at the payer level, at the education, the superintendent level, eventually what I'd like to see is a QR code on every student ID card. My daughter studied abroad. She was in Israel in October. She was there in September. And it occurred to me, first of all, if anything, God forbid, had happened to her, she doesn't speak Hebrew. So if somebody found an ID card, her student ID card, they wouldn't know how to interact with her. They wouldn't be able to, if they're only speaking Hebrew, necessarily to understand what Elena's English background is. So part of the reason why I made it web-based, I mentioned it's translatable. You open up the profile on the web page, click Google Translate, and now it's all in Hebrew or it's all in Spanish. So one of the goals that I have as CNME in making it ubiquitous is ensuring that level of health equity for everybody in the community by ensuring that that language is not an obstacle to this. So if we're speaking with, a new mom who's looking for care for her infant, if she can fill out a profile on that child, even if it's in Spanish, when she takes that to the provider, who's perhaps doesn't speak Spanish at all, he can translate what she's got there and understand what's going on with that infant and vice versa. And then they can communicate between providers to ensure that that child is cared for. So from a community perspective, I'm not exactly sure who to speak to integrate it in that way. And again, I think that's a couple steps down the road, but those are the things that I have in my mind so far. Well,
Okay.
open to any other perspectives for sure.
Yeah, no, fantastic. And one of the areas I'm very interested in is how to leverage AI agents and the health agents in the future. There was a 10G challenge that actually Kansas City Digital Drive helped be involved with with the actually MetaView was one, but looking at how to do telemedicine and we actually the 10G challenge Cable Labs helped talk about what is the future of personal AI assistance in healthcare. I could see your product helping, along with an AI agent as a possibility of this case.
And one way we've thought about implementing that is, say, with the foster care placement agencies, they have a lot of reports they need to write for kids. So some of the data we collect from the profile interactions are checklists that have been completed, custom checklists, arrival checklists, departure checklists, kids who have daily routines. digital breadcrumbs, all of those could be aided by AI to help those social workers come up with the reports. Just one idea.
Yeah, actually, I wanted to give a shout out to Dr. Castro. He created an AI tool to help, a chat GPT where you can, as a patient, you can, put some information in. And like even myself, I had some issues, and I could dialogue with this AI chat GPT agent or GPT to help me have better medical literacy on what my condition is, what are the things to think about, what questions to ask a doctor. The thing is you could say, okay, I want it to be written at a 11th grade level, or at a college level, or at a 3rd grade level.
Right.
I need to practice and see if I imagine it would work. As can you do it in Spanish or another language as well? One of the comments, excuse me, Dr. Castro.
It will work. Yes, sir. It'll work in different languages
And it
already.
does pretty good in Spanish.
Yeah, I was impressed. I translated a whole book that way and verified it.
Okay, well, fantastic. Yeah, so the ability to use some of these AI tools. So I reached out to you, Risa, on LinkedIn, and if you wanted to have a discussion on this topic, happy to have that.
Very good. Thank you. All I need is the financial investment to make that happen.
Okay.
Ashley, did you have a question?
I did. I was just wondering, and I apologize if I missed this. I did get pulled away temporarily for a work call that was urgent. But have you considered how you might incorporate this with, like, I know for example, iPhones have like the medical ID on the iPhone. So I didn't know if you considered how to incorporate it with things like that.
Yes, so that sort of integration and EHR integration is in the works. I'm real cautious about working with Apple because they tend to tell you what they want and then sue you until they can get it. But this also is not an app, it's web-based. So eventually I would like to be able to integrate the wearable information into the appropriate sections in the CNME profile. But again, one of those things we'll certainly consider. Just can't do it right this second, but I think it's a great plan and a great idea.
Perfect. Thank you.
Thank you.
Yeah, actually, to that point, where you have the QR code, like if like Apple just announced their Apple Intelligence, and if it'd be fantastic, to have a QR code generated by Apple, right? If because all of a sudden you get hundreds of millions of people having this capability. But again, there's concerns on both sides, but I may be talking to someone who has a relationship with Apple, and I could highlight this information. I'll send you an email. But I see this Apple ID being private and personal. Integrating with your systems may be a good possibility of working together, and also get some of the AI generation material kind of for free because it's already being developed.
Right. So long as it doesn't end up being an app or a portal that makes it difficult to share, that defeats the purpose of having of my mission of continuity and coordination.
Absolutely. No, totally understand that. Yeah. So it has to be able to, as you said, be shared outside of that. But yeah, great ideas, and looking forward to seeing how you're doing in this going forward.
Well, Risa, I think continuity of care is going to be really one of the biggest issues going forward. It's ironic how wired we've become as a health system and as a society, yet we still can't get people to the right place at the right time with the right information. It's a little bit scary. So I think you're very much along the right track there, and applaud that.
Thank you. And thanks for the opportunity to present to you today.
You're very welcome. I think we'll leave it at that. A number of people have joined us since we started. I apologize that we didn't have a chance to get everybody introduced, but thank you all for coming today. And thank you, Risa, for giving us great information and elucidating this for us.
Thank you.
Okay.
Hey, John.
Yes, sir.
Can we, I know since we don't have a second speaker, there's in the chat is these AI chat bots.
Yes.
And I wonder, I don't know if folks had a chance to review it, but Dr. Moran noted, I'm gonna opine here. I put a compromise position in, and Aaron commented as well. I actually don't like all these chat bots showing up in these events. One, because in a recorded thing, I feel confident that I can go back, hey, I didn't say that. And John can go listen to the recording, assuming that we don't have deep fakes on the recording, which we could have, but I'm trusting that we don't. But when everybody's throwing their AI pilots in this, it's kind of weird to think that all this stuff's being extracted out and then, digitized for use. And not that people couldn't send their notes out. But what about if we said, hey, we'll take an AI pilot, whether it's one of these ones that's there, and you can send out a summary to the meeting to the attendees so that there's one AI pilot that's listening in. And for people that want to get a summary of the meeting, they can get one summary of the meeting. And then we know at least there's a consistent summary out there. Maybe nobody else cares about this, but I think it's a burgeoning problem that maybe this is a really small example of it. But if anybody else has a comment, maybe they can make it now or we can pick it up in a future event. But anyway, I just wanted to note, well, I think it's a good discussion in the chat.
Well, as I just would say, as someone who has clearly been slow to the bandwagon of having an AI note taker, I don't have one. So maybe I'm got a bit of FOMO for everybody else who does have one. I certainly would value if an entity like this had one that was then sending out the notes per se. I guess the only other, devil advocate I would offer up, Dick, is what harm is having these AI note takers providing to the community other than substituting for a person actually showing up? Because I think I have noticed there's several of these for people who are not actually on the call, but they have their AI note taker instead of actually being present in the discussion, which that actually is a negative in my opinion.
I don't know that there's I'm and look, we've got Dr. Castro, who is becoming known worldwide for some of his opinions on this, but I'm a huge fan of these technologies, and I think this is whether we're called the fourth wave or the fifth wave, this is the next major transformation in how society will use information. So I'm not anti-AI even in a little bit. But I think we have a lot of unanswered questions, and I'll say specific to healthcare. And I think in meetings, I don't know, it obviously makes it much easier to publish stuff. I don't think anybody on this call has particularly nefarious intentions. But guys, we've all been, part of crazy situations where something you've said was taken out of context or whatever. I just think I think what should become standard practice in meetings like this is we agree that there's going to be an AI pilot and it's going to do a summary of the meeting and we can say, hey, check the minutes, right? I mean, anytime we record someone and we publish on digital health website or in my Cerner history, we always gave people that were participating a chance to see the recording, to see the minutes from the meeting, to see the extractions, to say, hey, we're going to publish this. Are you okay with what we either summarized or what you actually said? I just think it's part of kind of good hygiene for these kinds of meetings and events going forward. And look, I'm not particularly scared of this group. I think it's more of a emerging hygiene for AI in daily life. And I think we ought to think about it for this group. So that's all.
Yeah, and it fits with what you're suggesting fits with what our track record is, which is we do post video, but also the chat. That's something that most people don't typically post, yet there's always good information in there, like links to further sites, those kinds of things. And we post that as well as the slides. So posting another thing, in this case, the chat, or excuse me, the note taking, AI note taking, that could be done easily enough.
Yeah, I'm just gonna add my 2 cents. Big picture, I understand. AI is changing our workflow, the way we see life, the way we do things. I do want to mention that a lot of people that see the AI that they weren't here, for example, today, it's not that they purposely sent the AI for them not to come. I really think it's just part of when they sign up for the program, it links your Zoom account with your calendar and this app. And so it automatically sends it, but it comes through to people that don't realize that they're sending it. The other thing is, as we move forward, there's so much information. We're all multitasking. Something happens and we miss something. And I think for those moments, it's really nice to have these things transcribed. At the end of the day, just like we watch deep fakes, we watch the news, the newspaper, we interpret that data, and it's up to us ultimately what we do with that data. So yes, it could be biased. Yes, it could be inherently wrong, but inherently you're going to already get that information. So why not have those tools available? And then you, at the end of the day, the user, you decide if you want that data or not. And then from an etiquette point of view, if those bots are, whoever's controlling the meeting can kick them out. And so whoever really doesn't want them, it could be kicked out at any time. And then, so that's just my angle to it.
Well, I mean, that's a great perspective, by the way. And so if you look in the top left of your browser here screen, you have a little button that says recording, right? And we all agreed to that, or we don't get on the meeting. And yet showing up, and guys, for those of you that are using bots or people that are reading the transcript, I'm not upset at any one particular person. Look, we're part of something called the Ethical Use of AI Task Force. Aaron's on it. Some other folks in this call are on it. And I think we're just uncovering these kinds of issues. Here we're in a non-clinical, non-HIPAA setting, but we're talking about healthcare and technology. And I didn't consent to somebody's Otter AI pilot, even though I think the summaries these things do are amazing, okay? So, I mean, they're really, really good. And yet, I didn't consent to have someone summarize what I said. And not, again, I got to be careful here because I'm not upset with anybody's AI pilot. I just think we ought to think through, because we're at the beginning of a transformation. So like if you use a bridge and you walk into your doctor's office and the iPhone's sitting there and the physician says, oh, by the way, I'm recording this conversation such that I can make my documentation easier and I can spend more time talking to you, right? I mean, KU's had great success with this. I assume lots of other orgs. I don't know. I think patients so far seem to be reacting okay to it, but it's explicit consent, right? I don't know. Just think about it. We're not. This isn't a decision-making body. John and Aaron, you guys run the meeting. You make the call. I'm going to show up either way. I was just struck by the chat and Dr. Varan's observation, which I thought was thoughtful. So.
Yeah.
No, I think this is great. I appreciate this discussion, and I'm glad you brought it up and then continued it. I mean, I would say the other kind of interesting thing is that like the Zoom settings keep changing, you know, in terms of how easy it is to do it and how automated it is and how people show up and how those things get sent and who knows. So it's a little bit tricky to keep up with. And I think we decided maybe 6 or 8 months ago, just as a habit, that we would keep them out and then allow them in sort of one-on-one. But it's like there's not a global setting. I'm pretty sure we changed our global settings at one point, but then Zoom updated, and so it's different. And so it kind of like they keep popping up. I think the other thing that I mean, just to kind of reinforce something that you said, Dick, is this is really a cultural shift. And I think part of our just sort of overarching thought with the technology changes that move ahead much faster than policy or legislation, but also sort of drive culture, is how do we slow down and be intentional about that? And so, you know, to the question about what is the harm, you know, with a lot of these things in general, with any technology, like you don't know what the harms are. And that's part of like the sort of culture that we, again, organizationally embrace, is like, we want to be experimental. We want to be innovative. We want to test new things. We want to sort of understand what the harms are. or the potential harms, or how, and the potential benefits as well. But the we want to do it reflectively, which is hard. And so, like in the Zoom meeting case, I would say it does. I think you're right that most people aren't intentionally saying, "Oh, I'm not going to go and I'm going to send an AI," but it does have a little bit of a disincentive to attend if you kind of think just mentally, even if you never go back and read the notes. Oh, I'm just going to send my robot assistant because it's going to save some time. I think it is just a weird, and this isn't necessarily quantifiable or definable, but like when you notice yourself sitting in a room, say you're sitting in a room of 30 people and there's 5 AIs, you're like, oh, okay, well, that's weird. What am I doing here and who am I interacting with? Say that balance got up to like 15 people and 15 AIs, or 5 people and 25 AIs. Like it sort of erodes, I think, the value of people congregating with other people. In the same way, I mean, it's interesting. We've talked about this sort of with hybrid meetings and in-person meetings and virtual meetings. And we used to always do this health innovation team meeting in person pre-COVID. And we still occasionally talk about, the value of when we do our quarterly forums in person. But there was value to getting together in person. Doing it virtually allows more people to attend. And it's interesting. I thought I was really struck. Somebody and in the introductions said, "I'm here for networking," which is kind of a cultural transition that I think has happened. That people would show up to a virtual meeting for networking, because when we first started doing this, during COVID, that was a thing that people felt like we lost. So it's not like these things don't transition culturally. Anyway, it's sort of a scramble of thoughts. And interested in others' feedback as well. But Dick, I really like your idea of having a designated AI bot, because I do think there's a lot of value in that synthesis. But yeah, great. This is a great conversation. Curious if others want to weigh in.
We'll know how crazy things have gotten when we see how these AIs interpret a discussion that we're having about ditching AIs.
They actually do a pretty good job at that. They're good at self-critiquing. One comment is, since you put this on YouTube, unless you turn off the show transcription, it automatically generates a transcription of the. I use that all the time. Where and then what I do is I take the transcription from YouTube and paste it into ChatGPT and say, summarize this, or give me the top 10 things to do, the talking points of the talk. So, I find it very valuable to help summarize and organize, using AI to do this information.
Well,
Yeah,
I think I'm going to have my AI talk to your AI, and eventually we won't ever have to interact. We just have to get the
all our bots are talking to each other, and we just live in the matrix, right?
Yeah. Well,
the
okay.
CEO of Zoom said that that's what their goal is, to have these bots to do exactly what you just said. And then just to put this in another point to just think of, in the near future, Windows will have this already part of your computer. So it's either us or our grandkids, but eventually this will be a common thing in our workflow. And case in point, I always look at the positives. Say there was amazing information at this meeting a year from now that I thought, man, someone said something, I can't remember who. That incorporated in my computer already, iOS, I can verbally say, hey, talk to my computer and say, hey, I was at this meeting, something was said, can you find it? And it would go through the transcript, find it, give it to me. And then I say, hey, I want to send that as an email. And since it's integrated, it would be in an email sent to you guys. And since I'm doing a speech, let's pretend tomorrow on the topic, I would say, you know what, make that a slide into my PowerPoint. And it literally sends it to my PowerPoint. And so those are the tools and efficiency things that we'll be able to do. And so just keep in mind that, yes, it may seem a little odd. Yes, it changes our workflow. Yes, the culture has changed, but look at the positive side. How could it be more efficient for you? How could this be for good? How can this information that so-and-so said X, that I'm like, man, I really want that, I can now tap into that. So just mention that.
I mean, I think I'm going to go a step beyond that. And I think, look, I think we're going to have totally quantified life. I think everything you say is going to be recorded, right? You will have to pick a setting in your brain to not be recorded. I won't have to remember a damn thing anymore. I think it's transformational. I'm not, I met a bunch of people last night at our event talking about cyber. And I'm like, oh shit, oh, what? Wasn't I supposed to follow up with somebody? And I'm going to go, hey, Siri, who did I talk to last night that I was supposed to follow up with? Oh, I'll call Jeff here in a little bit. Okay. I mean, that's how this is going to work. I mean, we're already pretty damn close to that, right? I mean, if you think about how a bridge is working in a physician-patient interaction, we don't have to remember anymore. And we're going to be able to query this, out of the EMR. I mean, screw the EMR. EMR's passe, guys. We're not going to need EMRs in 20 years, 10 years. We're not. I mean, we're in the post-EMR world. Different topic, but that's what's changing. And I want us to be aware on the front end. Let's think about these implications. We're not going to have charts and graphs and store all this crap. We're just going to ask for it in plain language. I mean, this is what Dr. Castro's talking about. He's traveling the world with this story. We're in a post world. We just have to figure out how to live in it.
Yeah, you're going to have your personal AI healthcare agent that, just like Dr. Shanks talked about, using Bridge to have the doctor record what's in as everything is being recorded. Well, I think the patient could have everything being recorded as well, so that they can see, okay, what did the doctor say? And, did I understand it correctly? And ask it, okay, can you explain it more simply? Because I didn't quite understand that, right? Now, the challenge with this, and I was talking to a nurse at Children's Mercy yesterday on this topic, is the clinician has to be in the loop, because the AI can hallucinate. So if you're not, it needs to be, the medical information always has to be vetted by a clinician to make sure that there's no hallucinations and it's not causing harm, and as opposed to, actually having a benefit to the patient.
And I'm going to add to that. One of the things I often say at my talks is I give examples, and one will be, there's this device, and I'm not promoting it, I just seen it, it just comes to mind. It's called Limitless, and it's a little pendant, will be out in August. And I'm already telling my docs, hey, this is coming. Patients are going to be coming in, recording everything you say and transcribing, and it's going to happen. You're not going to like it. Ironically, you want it on the doctor side so it can transcribe your notes, but you're not going to like it when the patient has this thing on and it has summaries and it'll be able to quote. And then later, if God forbid it's a lawsuit, they're going to have it recorded. And so that's coming. And so I'm telling them, just start incorporating it into your workflow, because it's going to be here.
Yeah. And I think to your point, Dr. Castro, about being able to remember stuff. I mean, this massive 30-year effort to document in syntax, in a nomenclature and all that we can retrieve, all that work. I'm not saying it wasn't important. It's helped to train all the large language models and will continue to train. But this whole metaphor, that the way we store and retrieve information, is changing. I mean, this is the next wave, and I'm very excited, and I love hearing how you're describing this. I'm not familiar with that technology, but turnabout's fair play. And if you go back to Risa's thing here, wouldn't you like to have a recording of every interaction, and and change the way, and to be able to say, no, wait a second, that's not what you said last time, or you begin to compare across encounters and across episodes. So anyway,
That's
John,
just what I was
actually,
going to say to Dick, sorry, Dr. Castro, but if I had a calendar on the CNME app for upcoming appointments and past appointments, where you can click on that past appointment to hear what the neurologist said or to hear what the cardiologist said, it seems like a great way to ensure that continuity of care. Now, granted, yes, I understand it would have to be vetted and there are hallucinations there, but some aspect of a recap of an appointment on a calendar, so you at least then when the individual was seen, not just what the outcome of the appointment was too.
Yeah, and I'm not promoting this device. It has bad reviews. I'm just showing you a difference in workflow. I have this Rabbit R1 right here. I just got it. I forget when I got it, recently, in the last week or so. and I'm putting it by my computer on purpose so I can put it into my workflow. So it's literally AI, and I just speak to it and it gives me information. So I want to know what the stock is doing, what the news is, what the latest in AI, anything. I can just ask it. Granted, I can just go on Google and do the same, but it is nice as I'm working to be able to ask this thing any information, take pictures, analyze. And so when I'm on stage, one of the things I do with this device is I translate and show people how I could use this to translate into other languages. So again, not promoting the product, but just the workflow, the different way of thinking. So.
Hey,
No,
John,
that's-
can I make a suggestion too? This, I know I would have loved to have heard Dr. Love's presentation, by the way, but I think maybe every now and then in this monthly is leave some time for open discussion and put a topic out there that the group and note it as discussion time. I think this has been very helpful, and drawing a link back to Risa's presentation, I think is also very helpful. Maybe selectively every once a quarter or something, we create some open discussion time would be great.
No,
I don't know
that's,
what else you think, but
no, that's a great idea, Dick. In fact, we have done that very much in the past, particularly when COVID first came into play. We had a lot of general discussion around how it was impacting people. And so there's a good reason to continue that. And I thank you for bringing that up.
Yeah, one comment, there's the Black Mirror, the entire history of you, and about a person that's, with his interaction with his wife and how his wife interacts with other people. And he goes back and reviews it. And, basically it broke up the relationship. And one of the comments at the end was, relationships are best when you forget things.
It's a Black Mirror to that extent too.
Okay, well, thank you all very much. This has been very productive, I think, and we'll take it on board and start to make maybe some decisions about how we manage this. And so thank you all very much.
Yeah, thanks again.
Okay,
Thank
bye
you,
now.
everybody.
see you guys.